Okay, right, let's get started then. My name's Tazy. I'm from the COVID Action Campaign. My pronouns are she, her. So this meeting is about the fact that COVID cases are once again increasing and it's putting pressure on hospitals again. And more so than ever before, like this is basically nothing is being done about it, and nothing is really being said about it, despite the fact that I think probably all of us know people, more and more people among our friends, colleagues, etc., who again are being infected, many for the second or third time, some people who are being infected for the very first time after all these months and years. So today we're really pleased to be joined by two people from Doctors in Unite. So we're going to be starting, first we'll hear from Dr. Coral Jones, who's going to give us a kind of overview of what is happening with the pandemic, and then also address some kind of common myths about that. And then Dr. Jonathan Fluxman is going to talk about the kinds of actions that really do need to be taken, the kind of policies that we need to address this ongoing crisis. And then we'll have lots of time for first for questions to the speakers and then for open discussion. Okay, so without further ado, Coral, over to you. Thanks.
Yeah, thanks very much. Thanks for inviting me to speak. And so I listened to Independent Sage last week, and they reported on the ONS figures, which show that here we are again facing rising rates of COVID hospitalizations and ICU admissions, particularly in people over 65. It's very concerning as we're in early autumn and winter is going to be worse. There were 7,200 people in hospital due to COVID on the 28th of September. And this is actually an increase of 2,000 people from 2 weeks earlier. So the rates are going up alarmingly. And as they pointed out, the numbers of people with long COVID continues to increase. As there are more infections, there's more long COVID. The ONS has estimated there are up to 2.3 million people with long COVID symptoms, and 15% of those are severely affected. So while 15% doesn't sound many, this actually translates into 342,000 people with chronic debilitating symptoms from COVID infections, which could have been prevented. Long COVID affects people in deprived areas much more than least deprived areas, which is true for COVID deaths and hospitalizations generally. On Saturday, I was at the COVID wall. There are only now 2 panels at the end of the wall free of hearts. The wall will sadly all too soon be covered. There are already 40,000 deaths this year, making a total of 205,000 people who've died from COVID. The government and the media continue with the myth that COVID is over. We have beaten this with the vaccination program. And vaccinations do decrease risk of hospitalization and deaths by about 90%, but they certainly have not eliminated COVID. The government's tossing aside its responsibility, diminishing the seriousness, and 100 deaths a day is counted as a victory. This is turning away from grief and denial that this is happening. So how's this cover-up happened? There's a strong analogy with the climate catastrophe. There are active misinformation campaigns, attempts to undermine the science, and failure to acknowledge the urgency and persistence of the crises. So therefore, little need to address either. COVID deaths and illness and the climate catastrophe have been pushed out of public view by a complicit press, a government in denial, which has used COVID crisis and continued addiction to fossil fuels to enrich their friends and corporate sponsors instead of saving lives. We've been abandoned to COVID because we now have our freedom. Abandoning all protective measures is a political choice. It's not based on medical evidence. So Independent Sage looked at the myths surrounding COVID, which confuse people. They dispute the science and perpetuate the idea that COVID is not serious and is now over. It's worth looking at some of these myths that persist after nearly 3 years of COVID with ongoing illness and death. Firstly, there's the idea that COVID is just a cold. Colds are generally mild because there is a balance with our immune system and the viruses are fairly stable. COVID, however, is mutating all the time. It has features which make it very dangerous, which can affect the whole body. It causes deaths and long-term disability. There's no evidence it's getting milder. It is not just a cold. The same logic applies to the idea that natural infection will lead to herd immunity and so somehow eliminate the virus. This will not happen as repeated infections are possible and new variants are often more transmissible. The second idea is that it doesn't matter if children get COVID, as it is always mild. This appeared to be true in the first wave of infection, but with repeated COVID waves, more children are getting seriously ill. In 2020, there were fewer than 3,000 children hospitalised, but this year already, there have been 16,000 children hospitalised with COVID. And the other idea of being mild is to say that people are dying with COVID, but not because of COVID. So the significance of COVID is being overestimated. But COVID will only be on a death certificate if it contributed significantly to the death. Otherwise, even if a patient is positive, this will not be on the death certificate if the COVID hasn't mattered to them. So there are over 205,000 people where COVID has directly caused or contributed significantly to their deaths. The other thing is that COVID, the idea is that we can't beat COVID, so therefore why don't we kind of join it? It's never going to go away, so why don't we just lie down and let it wash over us? So Anthony Costello, who's a public health doctor from Sheffield and at UCL, spent a lot of time talking about this during the meeting. As he explained, medicine is about prevention and treatment of disease which kills and harms us. We don't just give in to TB, malaria, HIV, measles, pneumonia, meningitis. So why is COVID different? The logic that we can't eradicate it, so it's not worth fighting it, doesn't make any sense at all. Viruses are very difficult to eradicate, and only smallpox has ever been eradicated. So that doesn't mean that we shouldn't try and contain the virus. So we need good, sensible public health measures, which must not be shouted down by libertarians, shouting that is curtailing our freedom. The economic impacts of repeated lockdowns are real. No one is denying this. These repeated lockdowns have been caused in the UK by failure to implement public health measures when the lockdowns are over. So this has led to repeated infections and so further lockdowns when we're in this cycle. In countries which have controlled the virus without prolonged or repeated lockdowns, some or all of public health measures are in place. So there's test and trace, contact tracing, support to isolate, masks, ventilation, and messaging about crowds. Some or all of these messages have been used to prevent transmission. So there needs to be a vaccine plus strategy if we are to control the virus and prevent illness and death. And another idea is that long COVID doesn't really exist, it's all in the mind. And while there's no specific test for long COVID, tests show effects on many parts of the body. It's caused by changes, it has many causes. It seems to be caused by changes to the immune system, to cortisol levels, to microclotting in many organs, and brain changes can be seen on MRI sometimes. So different people are affected in different ways. And just because there are a variety of symptoms and a variety of ways that it affects people, it doesn't mean it is all in the mind. There's another story that vaccines are worse than the disease. So far, 12.7 billion doses have been given worldwide, and there's been very close studies of side effects and very little evidence of harm. But there is evidence that vaccines do decrease serious illness and death by 90%. And the masks controversy still rages. They do work. They protect oneself and others. We need good quality masks and they need to fit well. So we need either N95 or N99 masks, which can just be bought at the chemist. There's a myth that masks decrease blood oxygen levels, weaken the immune system, cause mental health trauma in children, and none of this has been shown to be true. Lip reading, of course, is a problem with masks, and workers working with deaf patients need to wear clear shields. Psychologists have asked why there is resistance to public health measures in the UK, given ongoing infections and deaths. Where is the public outcry? A psychologist speaking thought that as the government denies there is a problem and isn't talking about it, when people are confronted by a story of ongoing risk, they can feel powerless. Who should they believe? What should they do? To deal with this conflict, people will minimize the threat by saying, oh, there's not much around, as the government tries to pretend. It's getting milder, it won't affect me. It's easier to follow this narrative that it's all over. In fact, when I get on the bus and I'm the only one with the mask on, I think, well, will I get it or not? Is it really all over? This image is given to us from the media continually. It's important to counter this by pointing to how we have to have clean air and how this can be achieved. Individuals can act, but efforts must be supported by government, workplace, and unions, and this will empower people and give them the confidence to take action to protect themselves, their workplaces, and their family. So in summary, COVID hasn't unfortunately gone away. It remains a serious threat to public health, and measures must be undertaken to protect all of us. Thank you very much.
Thanks very much, Coral. Fred, was that a hand or no? No, okay. Okay, thanks very much. And Jonathan, when you're ready, I think you should be able to unmute yourself as well.
Right. Thanks very much. And thanks very much for the invitation. It's great to see you all, and I see some familiar faces of friends and colleagues in the audience. I'm just going to share my screen because I have a few slides to show. Great. Can everyone see that okay?
Yeah, we can, yeah. You
can see it, great. Okay, so that's who I am and how you can contact us at Doctors in Unite. Just before talking about what we can do to avoid reinfection and try and keep ourselves and friends, family, and community safe, I just thought I'd run through a few points about why it's so important not to get infected again and the basics of COVID transmission, because that's the key to understanding how we can protect ourselves. Excuse me. So this is a study that was done recently or published recently, a Veterans Affairs study, which shows that every subsequent infection makes things worse. And if you look at the bars on the right here, these are the proportion of people with adverse outcomes across a range of different bodily systems, if you like. Everything from your brain, heart, kidneys, gastrointestinal, neurological, psychological and cognitive, etc., etc. And every single indicator gets worse with every subsequent infection. So every infection matters, and it's really important not to get reinfected. I'm more or less assuming that we've all had at least one infection, although some lucky individuals have managed to avoid it until now. There was an excellent webinar put on by the World Health Organization, World Health Network, sorry, and I see Yanya Bayam is in the audience tonight. And this is what a slide put up, the only slide put up by the speaker, Dr. Cecile Philippe, which I think is a very important concept in terms of long COVID. What we can see here are deaths and hospitalizations. This is the visible bit of COVID. This is the long COVID bit, the invisible, much, much, much bigger cost to society and communities of this terrible disease that we're still grappling with. Just some latest figures about long COVID, a recent ONS study from last week. 2.3 million people now have it. More than 1 million have its symptoms for a year, and more than 500,000 for 2 years. And many of those people have quite severe disability from the disease, to the extent that they can't function, they can't work, they can't exercise. So it's all about exposure. It always was, and it will remain so. And I'm talking to the converted, I think, by and large in this audience. You know the risky environments to avoid. So I won't go through them. But just to say that public spaces, workplaces, schools, public buildings, public transport are key to driving transmission. Most infections actually happen within the household in terms of numbers, but in terms of spread, transmission through society, big public spaces with lots of people are really important. And again, you probably know this, Herd immunity is a myth. This is a quote by Professor Danny Altman, who's a member of Independent SAGE and quite a well-known and well-respected immunologist here in the UK and internationally, I think. And basically, he describes it as we're being trapped on a roller coaster in a horror movie in terms of the virus constantly evolving, and we're playing catch up and losing with vaccines. COVID's airborne, we all know that, it's always been that way. This is a quote from Professor Richard Corsi, who's at the University of California, Davis, who together with a colleague developed the Corsi-Rosenthal box, which is a portable DIY air filter, which I'll talk about in a bit. But I think this quote is quite opposite in terms of describing what we know about transmission. You probably see in this diagram many people. I'm putting it up because there's two aspects to transmission through the air. Near field, when you're within somebody's expiratory plume, and far field. Ventilation and air filtration will clear this virus, this bit of virus here, for far field transmission. It won't deal properly with the near field. You do need a mask to protect you from that as well. Just a word on super spreading. So since quite early on, about mid-2020, the transmission characteristics of this virus started to become apparent. And it's clear that these big super spreading events are very important. This is just a couple. This was an outbreak of COVID in Northampton at the Greencorp sandwich factory. They make sandwiches for Marks and Spencer's and others. And there was this huge spike over a couple of days in August 2020. And this is a graphic of that famous outbreak in the call center in Seoul in the early days of the pandemic, when again, huge numbers of people infected over a few days. And this is the hallmark of a super spreading event, one or two infected individuals infecting everybody else almost in that space because of shared air. And of course, the Greencorp workers got blamed because they weren't socially distancing. They caught it in the community. They were getting together during smoke breaks. The employer, of course, had done everything possible except fix the ventilation, as far as we know. And the local director of public health agreed with them. This is a more recent study of outbreaks in schools in Italy, in the town of Mede, I think that's the pronunciation. And this shows quite nicely how important super spreading events are. And to me, it's, they're a bit like cluster bombs. That terrible weapon that's been banned by many countries, where one device sets off a number of other smaller devices which themselves can explode. And if you look at this part of the graph, you can see that these are outbreaks in schools, which then transmit to other people, which then transmit to other people. And then these are transmission events inside the community, in households and so on. So it shows you that one or two infected individuals within a common space, like a school, can infect many others who then go on to infect others, and so on and so forth. And this is a very important driver of transmission. It's sometimes called overdispersion as well. This is just another study which demonstrates that a huge study in India carried out in the first year of the pandemic. 5% of individuals accounted for 80% of cases. That may have to do with characteristics of how people excrete the virus in their aerosols as well, but it's true that a small number of people drive transmission for very large numbers of others. So what can we do? Airborne protections work. They are really important, and they do work, okay? And Coral spoke about the myths that prevail. You have people, the minimizers and the doubters, casting doubt upon these measures, but they are actually very effective. Vaccines are essential, but they're not enough on their own. Other things like testing, are also very important, supportive isolation. But I just wanted to concentrate for the rest of my talk really on the airborne mitigation measures. It's really down to us as individuals and as communities, and I would say activists and campaigning organizations like you guys, to make sure that we keep COVID on the agenda and we drive the movement to implement protections, because the government ain't going to do it and employers are not going to do it. They've made that abundantly clear. It's very striking to me, actually, how when the UK, in the middle of last year, suddenly decided to drop all mitigations, within a few weeks, almost all Western countries across the world had done the same thing. And it's quite clear to me that they obviously talked to each other and they decided that enough is enough. Profits are down. We can't have business interruption like this. We're just going to get rid of all the precautions. That's a little cartoon I drew for Twitter, which sums it up about how vaccines are the be-all and end-all of our approach to the pandemic. And they are failing on their own. They're critically important to prevent serious illness and death, but on their own, they are failing. We need physical devices to clean the air or to replace virus-infected air to help us, as well as masking. So CO2 monitors. I'm not sure if you can see my face, but I have one of these with me, but I'll show you in a minute, perhaps. Very easy to use. There's some great devices on the market. They're really helpful. There are limits above which ventilation needs to be improved. Again, there's controversy with government guidance in the UK, always taking the least, how can I put this? Setting limits that are basically too high to provide proper safe levels. And again, for the benefit of employers, so they don't have to intervene earlier. So this is the device that I've got. It's one of the most popular ones. It's really reliable. It connects to your smartphone and an app wirelessly. And that's the kind of graph you get of CO2 levels. I'm assuming people know that CO2 is a proxy measure for ventilation. This was a train journey I took about a year ago down to Bristol. And you can see it was well over 2,000 for a large part of the journey. Not good. Some other tracings. This was another train journey when I went up to Stoke-on-Trent a couple of months ago. This was a journey up there. You can see reached almost 2,000. This was a journey coming home, much better because the train carriage was a lot less crowded. And this was a central line on the underground. You can see that peaked at 2,000, well, over 3,000 actually. Fortunately, it was a short journey and I had my FFP3 mask. That's why it's so important to wear a respirator mask on public transport. This is what happens. And our train services here in the UK, as we know, are almost always crowded, intercity trains, that is. If you can get on a less crowded carriage, if you've got the time, but have your mask. And they really work, these devices, as I was saying. Coming on to air purifiers, I've mentioned the Corsi Rosenthal box, but there are lots of commercial units you can get hold of. Here's some information sources. I'm quite happy if you want to share these slides afterwards. And some studies here at the bottom of showing how effective they are. Do not listen to the naysayers. These things work. Whenever they're put into place, they work, they reduce transmission. So that's a DIY Corsi Rosenthal box. There's a link to a video how to make one. Here's a more commercial one, which is obviously more expensive, but will do the job. There are some technical requirements about getting the right size and airflow rate to clear a room, which you need to look into, but it's not rocket science and it's quite easy to work out. And there are lots of people around to get advice from. Masks, of course, are really important. oops, sorry, they work. The issue of masks has become quite toxic in many communities and in many nations. I've only put up an FFP2 here and a surgical mask, but of course the FFP3s, which is the one I wear now, which is a slightly better performance than this one, although FFP2s are pretty good. Lots of studies that show they work as well, of course. And then more complicated proper heating, ventilation, and air conditioning systems, for which you need an engineer, unless you have training, to really advise about it. But you can ask about this at work. When was this system last maintained? Have the filters been renewed? And I've seen posts on Twitter by engineers showing birds' nests in the air intake of HVAC systems, and filters which have clearly not been changed for years, and so on and so forth. Opening windows is obviously important for natural ventilation. When it's cold and it's coming towards winter, the temperature difference will drive quite good air exchange. Use your CO2 monitor and you can get a good idea about that, but you may need air filtration to supplement that. Another study showing how effective ventilation is in Italian schools. This was published a few months ago. And it basically showed that the more you increase ventilation, the lower the number of infections. And when you get up to 6 air changes per hour, over 80% of infections were prevented. And the link is there if you wanted to have a look at the study. Another device or way of reducing transmission indoors is UVC light systems. The engineering is complex and you need an expert to install it and so on, but they do work and they are very helpful additions to other interventions. So just before I finish, I just wanted to spend a minute on the COVID pledge. This is a campaign that's been going for some months, launched by Independent Sage and several trade unions. And it basically what it does is it asks organizations, employers, trade unions, community groups, and so on, to adopt a pledge to protect staff, users, and customers from COVID-19, to assess the physical environment and working environment, and put into place protections, and to enable those who get infected, and this is more for employees, to take time off, not to lose money, so that they can recover. And when they come back to work, they are free of infection and will not spread it. So this is an ongoing campaign. You can sign up to it here. We've just produced some new leaflets. The PDFs are here, and if you want to print them off. But it's a really good way of opening the conversation in your trade union branch, with your work colleagues, with your employer, and so on. And getting them to sign up would be the first step, and then you can discuss with them the steps to make the environment as COVID safe as possible. And thinking about it, local businesses, restaurants, and so on. I personally would go to visit a restaurant that has a CO2 monitor reading in the window and has got a COVID pledge plaque as well, saying we take COVID seriously, we clean the air, and your risk is going to be low in our premises. So it's well worth it for their from a business point of view as well. So just to end then, we know no one's coming to save us. Government has abandoned all the protections. Employers are doing nothing, almost. Some good employers have, I should qualify that. Health and Safety Executive Watchdog has failed utterly to protect us. It has not brought a single prosecution over COVID breaches by employers, despite having received hundreds and hundreds of notifications from trade unionists and health and safety representatives. So it's down to us as activists. There's a lot of political activity in this country right now, a lot of trade union activity. Trade union movement is getting up off its knees and fighting back, which is great to see. I think we should all push as much as we can to try and get COVID onto the agenda and onto the list of demands. If we say things like we demand clean indoor air, hopefully they will agree with us and include it in the demands. But it is a fundamental demand for us right now, as important as, above inflation wage rises and job security and so on. And I would say that for the activists, the trade unionists and health and safety representatives, it's so important that we keep ourselves safe, because if we get sick and we've got COVID, it takes out those who are fighting back and weakens the campaign. So it's really important that we protect our troops, so to speak, against this disease so we can effectively fight back. Okay, so I think I'll stop there, but just to repeat, the technology is there. It's not difficult. We need to fight to get the resources allocated and to get those with power to accept that this is a critically important venture and initiative, and it really needs to be done. Thanks very much.
Thanks very much, Jonathan. Just to say, I think someone was asking for your contact details again that were on the first slide. If anyone would like.
Okay, shall I post that in the chat?
Yeah, please, thanks. So we can now allow some time for just like any questions, whether that's like factual or kind of more political stuff. You can use the raise hand function for that. So you'll find that under reactions and then raise hand. And then I'll just take people basically in the order that they come. And if people could maybe keep their questions like relatively brief at this point, because we'll kind of move more into kind of open discussion later on. Okay, there are loads of questions, so if people could be quite precise with their questions, that would be great. Why don't I take the first three, then go back to speakers on the second three. Elena, could you start, please? Thanks.
Yeah, I think there's something in long COVID, isn't there, about how it affects genders, women or men. Yeah, and I watched a really good Northwest London lecture about long COVID and HRT, and that women have dips in their estrogen during their cycle is when they get the worst long COVID. I think this needs to go out to women in particular. I've taken it back to my GP. I've taken it back to the PCN long COVID group. My GP is now contacting a gynae so that it can be activated, because women who are rating their health with long COVID as 2 out of 10 and being really debilitated, including brain fog, have had HRT and they've gone back to work, because there is this difference. And so part of the problem with the whole government thing is that women who have good estrogen levels will tend to be better at not getting the same impact from COVID. And you can be your age, in your 20s, Tazy, or whatever, you can have poor estrogen levels. There isn't an age thing about when a woman has poor estrogen levels. It can go right over, and women over 60, we can still have HRT. If you've still got a womb, you have the progesterone, but you can have testosterone put in there to help with the aching and everything else. And you can, it needs us as women to ask about this. They didn't say anything about men. I'll be going to the one on cardiology, and because of the microvascular angina, which apparently I've got as a result of myocarditis from Omicron, syndrome X, as it was called, can be successfully treated with testosterone. So there's still this thing about women being treated as neurotic, hysterical, and not being believed on the same level as men. I'll leave it there for the discussion.
Thanks. Roderick? Roderick, are you able to unmute yourself?
Yes, sorry, on my phone I had to go back and put in the passcode. It locked me out. I haven't actually been able to attend many of these because it always clashes with something else, but I happen to have a free evening. I had a lot of things to say. I'll cut it down to just 2 points. The first is that the whole pandemic has actually helped bring home to me how the vast majority of non-disabled people, I'm sorry to say, don't really care that much about disabled people. And I think this is kind of what's part of the narrative here, that, you know, it's people who are, quote, clinically vulnerable who are dying. So if somebody gets COVID and dies, well, it's a great shame, but they were disabled. That's that. And this narrative is definitely out there. And it helps to demonstrate, I think, more clearly to me than ever how ableist our society is. The other thing I want to say is, in all honesty, I do feel extremely pessimistic. It does seem to me that the government has managed to successfully win the overwhelming majority of people in this country to their narrative, hands down. They've basically won hands down. I don't see that changing at all unless, heaven forbid, the pandemic comes back in a way that it did at the start, with thousands dying a week, which of course we all hope doesn't happen. So it seems to me all we can do is basically try and raise arguments and awareness around whichever small bands of people are willing to listen. I don't think we'll be able to do, I don't see us being able to do much more than that, I'm afraid to say.
Thanks. Pat, I'm just clicking ask to unmute, so that should pop up for you now.
Yeah, a couple of points. The first one is FFP2 masks, single use, cost £2 each. Now, I think the cost of actually protecting oneself is a significant deterrent to a lot of people who are on low incomes and can't afford those kinds of costs. So I'm wondering if we can raise the profile of the question of cost a bit higher. That'd be my first suggestion. And the second thing is, I was disturbed when I went for my booster jab to go into the chemist and find that I was in a crowded post office with nobody but me and one other person wearing a mask. And when I went into the tiny cubicle at the back, the man who was administering the injection wasn't wearing a mask either. And when I asked him about it, he said the government doesn't require me to wear a mask. And when I've raised this with health professionals, or should I say, with my MP and with somebody in the local sort of health authority, they said the same thing, you see. They said the government does not require this person to wear a mask. Now, how are we going to fight against that kind of thing? Because obviously it's not acceptable at all, is it?
Thanks. Coral and Jonathan, would either or both of you like to come back in now, or should I take a couple more?
I'd just like to respond to Elena about the HRT question. It's very interesting because since COVID has come along and there's been medicine shortages, there's been this really big push that that HRT is one of the things that's missing. And many GPs, we've been spending years trying to not assume that everyone should be given HRT. So there's been, because HRT was imported from the States and everyone should have it. And then we've spent many years trying to figure out and see the evidence and see who will benefit from it or not, because it has got side effects. But Elena, I'm not actually aware of this sort of study. So I'll certainly look that up though, and try and find out something about it. Yeah. And Pat Turnbull, I'd just like to say that, well, the masks I buy are rewashable. So the ones I last bought at the chemist were 3 for £5, and I wash them until they get a bit raggedy, I suppose, in the other front one. But I think they should be free. And the boxes where you can buy the big 50 of the surgical masks are sort of fairly useless. So we do need to have free or very subsidised, better quality ones. And Roderick, COVID has really exposed racism and disableism in our society, which seems to be well and truly entrenched. And I don't, as well as not addressing anything about COVID, I think the government has failed to address those questions as well and keeps sweeping them under the carpet. But there may be other people on here who will comment about that as well. I can see someone already. Okay, I don't know, Jonathan, if you want to say anything extra.
Yeah, and I think you've covered pretty much what I wanted to say, Coral, thanks. But yes, absolutely about long COVID being much more common in women, particularly in the healthcare professions and care homes and teaching. Ableism is dreadful, and as Coral says, the pandemic's really brought it out. Oh, did they have underlying conditions? Oh, they didn't catch it in hospital. So what, it doesn't count? And it's been pretty bad. But, you know, I don't really share your pessimism. I think that, you know, they always look strong until they fall down. And they will keep going now. They cannot afford to backtrack. I don't think we'll ever have a lockdown again, even if 5,000 people a day are dying. I think they are so entrenched. And you can see from the economic and political program of this government in the UK, they don't seem to care at all about the welfare of the majority of people. But, you know, workers are standing up and fighting back. And I think we should really work as much as we can to work with local trade unions, to go and visit them on picket lines, to raise the issue of COVID and so on. There's a real appetite I'm finding out on the street, going to protests and leafleting and things like that, for people to do something and fight back. Raise it wherever you can, give out the leaflets, start demanding it. It's only pressure from below that's going to do it now. They are not going to come riding to our rescue. But I think there's a lot of reason for optimism, given the huge levels of militancy that we're seeing out on the street. And just very quickly on masks, yes, you can use FFP2s and 3s more than once. Make sure that the seal is good. But if you're careful with the way you put it on and take it off, you can use it 5 or 6 times, no problem. They are a cost, and absolutely we should all be giving them free. And in a number of countries, there are projects that do this. Health professionals not masking and not requiring, absolutely dreadful. But people may know that the Infection Prevention and Control Cell in this country is, to my mind, guilty of the most dreadful crime of still insisting that healthcare workers do not need respiratory protection, and went along with the government saying that people didn't need to mask again inside hospitals and healthcare facilities. I mean, it beggars belief that this can be taking place. And a lot of people have been writing about and raising this issue over and over again. And please, wherever you come across it, protest loudly. Shout at people at the hospital if they tell you to take off your FFP3 mask and put a baggy blue surgical mask on, which some people have been asked to do. It's just madness. And they are unaccountable and anonymous, the people that make this policy. And we need to call them out and get them to account. It's amazing that somehow airborne transmission can stop at the doors of the hospital. It happens everywhere else, but not inside hospitals. Thanks.
Thanks. I'll take another string of questions / contributions. David.
Thank you. This question, I've got a question and a comment. The question to Jonathan is, I noticed from one of his slides that IPC are flat earthers, and don't think that the coronavirus is spread by, airborne. What is the IPC? I ought to know, but I don't know what IPC stands for. The other thing I wanted to say, aimed at or agreeing with what Roderick and one of your speakers said, I would go further about this business about ableism and disableism. I would say that behind the government policy or lack of policy is a really nasty, unpleasant, vicious, eugenic air about it. It's horrible. In the days of the Third Reich, at least those bastards were honest, and they called it a useless mouths policy. And that's what we've got going on here in the background, I think. Thank you.
Thanks, Daryl.
Hi, yeah, thanks for that. Yeah, also going back to Roderick's point and something that Jonathan just said there, I've frequently over the recent months addressed meetings with 40, 50 people of mostly cynics. So I'm trying to fly the flag. I'm trying to get out there and trying to, not just preaching to the converted, but going out and really facing up to people who just don't want to face up or just ignore COVID. And I am, including this morning, had some success. I've got another one tomorrow, actually. Having some success at winning some over. That's, you're not going to win the whole lot over, but just by listening to them. A common thing that I keep saying to the groups, and even the cynics agree, that it would help enormously if we could find some information about, particularly, people have been hospitalised and sadly people that are dying. I've been trying almost since this outbreak started. I work with the health authorities, and also nobody can get information. And if we knew, for example, of the people that are dying, as I say, sadly every day, how many of them have been vaccinated now, how they haven't been vaccinated, for example, that's the big question. What age groups are they in? Putting information out there, because whichever way you got that information, you could take positive stuff to whichever group and actually help to win them over. And particularly the vaccination against the unvaccinated. Either way, whatever the facts are, you could use it to good effect. And every group I'm with, even the cynics, are saying, yeah, that would be really interesting to know that. Are they nearly 90% of people dying? Have they not had the vaccination? If that's the case, that's helping us to get the other people. There's about 25% who aren't vaccinated out there. So that would help us to get facts across there. Or if it's the other way around, then we could still talk to people there and say, you're not safe. You're not as safe as you thought you were, even though you just had a vaccination, whatever, but all sorts of figures. So basically, I'm just asking, does anybody know any source, or does anyone have a view about, why don't we get any information, the meaningful information about hospitalizations of people that are dying?
Thanks. I'm going to take a few more before I go back to the speakers. Barbara, would you like to?
Yep, there we go. Thanks, Jonathan, and thanks, Coral, for your presentations. And being in the same neighbourhood as Coral, and also Pat, who spoke first, question-wise, a lot of all my little notes have made very similar line of either comments or mostly rhetorical questions. Following on from what Pat said, I can attest that this particular pharmacy is absolutely dreadful. Even on a Saturday, packed out post office, a really very unpleasant pharmacist, no name badge on him, so you couldn't pin down what his job actually was. No mask, no gloves, refused to put on gloves, said he was allergic to latex, which didn't make sense because, his pharmacist, what do chemists sell? Latex-free gloves for people who have allergies. And he didn't wash his hands before giving me the vaccination and made a point of, look, I'm going to wash my hands now when he finished. And I'm in a wheelchair. The doors take a cute right turn into this little, it's basically a Harry Potter style cupboard under the stairs. There was barely an inch either side of my wheelchair. So again, it was not accessible. We see the question, why have our designated COVID vaccination centres been closed? I don't know what it's like outside of Hackney, but that's what's happened in Hackney. And also transmissions, encouraging people to get vaccinated. Council should do more to encourage people to get vaccinated again, not just pinning posts on their social media and sending out their emails if you subscribe to them, but also notices up on the front doors of their public buildings, like libraries, for example, community centres. Because this winter, there's going to be a rise in people using these facilities because they can't afford to stay at home and put their heating on, simple as. Disability is something else I've also written. The EHRC, can it be appealed against because they ruled out having long COVID designated as a specific disability? Can anything be done in that respect to the EHRC? Because people that are claiming benefits, disability benefits, they can't put long COVID to get them, if you like, PIP points to get their benefits. Yeah, let me see. I think FFP masks, where I can help out, if I can locally, I'm a frequent flyer to hospitals, and I always make a point of, can I have some of those, please? So if I can get some, I'll send some out to people. I'm back at hospital tomorrow. So yes, I have the ones you can change the filters in and the proper FFP masks. But again, right, there should be a way for people, especially on lower incomes, that kind of thing, for them to be able to, and testing kits, no one's mentioned that yet. The cost of testing kits, you know, again, for people on low incomes, and the disability question again, it's rife, ableism is rife. It was before COVID, and it has got a lot worse since, as in the attitude of this pharmacist in trying to get my wheelchair into his cupboard under the stairs. Anyway, thank you. Rant over.
Thanks, Barbara. It looks like somebody, Sarah Cole, has posted an ONS link that apparently includes data broken down by vaccination status. And Andrew's just posted about an employment tribunal that classed long COVID as a disability. So my understanding of that ruling was that that wasn't like a blanket thing that would then apply. It was like it's case by case, but it was kind of one of the first ones that found that it did count as a disability. But it's case by case, as I understand it. I'll take Joan, then Gary, then Frank.
Right, thanks. We thought Boris was bad. We have a Prime Minister who can't even tell people how to reduce their heating bills, and doesn't understand that actually when you're talking about how do you reduce heating, you're actually talking about how governments and corporations reduce heating in terms of wasting energy. If you look at what's happening across the continent, where you see that times of things have been changed, that government buildings are switching their lights off at night, you know, it's not, but it's the same thought process as they've had all the way through COVID. It's the responsibility of the individual, not of the state, and in order to protect us, and that is going to not get any better, even though we have to keep demanding and demanding and demanding, and see how long it takes them before and how far the numbers go up. Whether they last that long, of course, is a moot point. I wanted to raise the question of hybrid meetings because it's something I've been banging on about as somebody who is kind of more or less permanently shielding. I do go out a bit, usually to hospitals, but I don't go to meetings, and I'm a political activist. And it's been, a number of us on the steering committee have had arguments with trade unions in particular in London in terms of making sure that meetings are hybrid, particularly as we know they have the facilities in order to do them. I've got an interesting tale which quite shocked me. I was invited to speak on a panel at the LSE, not on COVID, but on taxation in a couple of weeks' time. They tried, first of all, they thought that the whole lecture was going to be on Zoom, re-hybrid, but it's complications about showing a film. Then they tried to see if they could just kind of, why couldn't I do Zoom as a panel member? And have now been told today by the bureaucrats in the LSE that they can't set that up for one person. Now they have the facilities. It's not a, you know, they must have. And I was actually quite shocked that they can't facilitate that. But it's what's happening all over the place, that organisations are being told that they have to have in-person meetings, that they can't have hybrid ones anymore. I think councils were actually told by the government that they have to hold full council meetings in person, regardless of the situation. And clearly that's also happening in Parliament. And I do think we have to keep banging on and banging on, because it is about, it's part of the whole thing of the disabled don't matter, but it's not just, hybrid meetings are not just about disabled people. It's what we've discovered during the pandemic as one of the pluses for an awful lot of people. Some people can't stand them, fine. But for those who either are stuck at home because of age, disability, illness, or caring responsibilities, which number one, you actually should be the top of the list of why you can't get to a meeting, then why can't they provide it where they have the facilities? And I do appreciate for some things facilities, you know, it's a new area that they're arguing for. But I do think we have to keep banging on about that, because if we're actually going to exclude people with disabilities and people with care responsibilities from the whole of the rest of society, to then exclude them from the ways they can participate is yet another nail on all of our collective coffins, isn't it? One positive thing though, because if you do bang on about it, you can get some good results. I run a community centre and our landlord is actually going to provide and install all the technology needed for proper hybrid meetings in our main hall. So you can get it. People aren't totally Neanderthal about it, but it is seriously something we need to bang on about and needs to be included in our demands. My final point is we've just watched major conferences, super spreader events. Actually, so many people stayed away from the Tory Party conference. But we're also, and I agree totally, Jonathan, saying we need to be supporting workers on struggle. But there's an awful lot of pickets with no masks on. And okay, they may be outside, but my union branch secretary has been going to loads and loads of pickets. I think they've all got used to getting up at 5:30 around here. It's just got COVID again. You know, it becomes super spreader events, even if they're outside. So we do enough, and I don't like using the word, but we do need to nag at them all. That just because it's outside doesn't mean you don't have to wear a mask, because you can still get COVID from the person you're holding the banner with. So yes, let's support them all, but don't support them when they're doing like Enough did in Clapham when they held a major in-person meeting, which was absolutely heaving. We need to be saying, don't hold those meetings. We need to make sure that they're also online and get the technology affordable and workable and enough people to expert it so that we can actually do that. Thanks, sorry. I just had my rant, Tazy.
Thanks. Gary, wait, sorry, just quickly. So we're currently at 7:04. I think we're going to go on until 7:30. And we do want to have time to go back to the speakers. Also, I think it would be interesting to put a little bit of time aside to talk about the strike ballots in the NHS that are coming up, which I'm sure we've got a lot of knowledge about in the room. So yeah, Gary, then Frank, then I'll go back to the speakers again, and then we can have maybe a little bit of discussion about the strikes. Gary, go ahead.
Yeah, good evening, everyone. It's been a really good meeting so far. I've really enjoyed it. My question is, really, we're talking about having warm spaces for the winter for those that can't heat their home. Yeah. Now, the thing is, people are going to go into warm spaces, but are they ventilated enough to have people in warm spaces because of COVID-19?
Thanks, Gary. That was so concise. Frank.
Cheers, thanks. There's 2 points really. The first is our local health campaign group in Cheshire and Merseyside, which Dave Pedd is a member of. We're in battle with the local integrated care board, who don't have a COVID safe situation. We've had 3 meetings now over the last 3 months. They have public meetings, and there's no mask wearing. There's no ventilation. There's no filtration system or anything. We've written an email. We've confronted them face to face. I confronted the chair, who's a consultant, last week, and I said, "What are you doing? You know, this is a health body. There's 4 medics here in this meeting," and they just said, "We're following the government guidelines." And I said, "Well, the government guidelines are rubbish." And he said, "I know." And I mean, it's just, this is a health body. These are the people who are supposed to be administering what was the NHS locally. We know what they're actually doing to it, of course, that are helping to destroy it. So there's that, and we've got to up the ante on that in terms of what we're going to do next to try and expose them. We have written to the local press, but nobody took that up. So that's an issue there, and this is a health body, with medics on it. The other point, I absolutely agree that we need to plug into the upsurge in unrest at the moment, and the street activity and what's happening on the picket lines and so on and so forth. Right at the beginning, or pretty well at the beginning of the Enough is Enough campaign, we tried to get the campaign to include the NHS and the demands, for a return to a fully funded, publicly owned NHS, etc., onto their demands. And so far, we've not had any luck. We've just hit a blank wall for some reason. And we've gone through Ian Byrne, who's a local contact, the MP for West Derby, who's great. Ian's fabulous. But so far we haven't got anywhere with it. I mean, we're not giving up on that, but it's, as Jonathan said, it needs to be one of the demands. The whole health thing, NHS needs to be one of the demands, and also a demand for proper COVID space, COVID safe spaces and so on. So yeah, I mean they're just sort of 2 of the things. I don't know if other people have had any experience of enough is enough as such, and trying to get the health issue onto the one of demand. I mean, I fully support what they're doing, been to the demos, etc. Again, a similar thing. The inaugurate the first demo, or the first rally that they had in August, was in St George's Hall with 1,000 people. The only people wearing masks were those of us from the Cheshire and Merseyside Health Campaign, and so on. So, there's an issue there. We did raise it, and people didn't know what we were talking about, it seems, so yeah, so it's, we've got a problem in the movement as well, as we've said. Okay, cheers.
I'm gonna quickly take myself to build on what Frank was saying there, because I think that it is true that while what Enough is Enough has perhaps contributed is kind of a general feeling that the strikes are part of a kind of wider movement about the cost of living crisis. It has been a very top-down campaign, and not one, it launched with its demands already fully formed. There wasn't that wasn't the outcome of any kind of engagement about anything. And it's been pointed out in the chat, obviously Enough is Enough is a campaign about the cost of living crisis, which is a relatively specific issue. But I do think it is pretty incredible at this moment in history to have a campaign that is trying to kind of be the umbrella campaign of campaigns almost, that is not mentioning climate, is not mentioning COVID, is not mentioning anything to do with racism, borders, like nothing. It's all just purely money issues essentially. And I think that is just anecdotally, I've heard that they've responded in a quite hostile way when as in individuals, I don't know, not organizationally, but have responded in a quite hostile way when disabled people have sort of said, I don't really see myself in this, and that gets shut down. So I think it is a problem. Enough is enough. And there is a coalition of campaigns that is active that takes in a COVID angle, which is called SOS NHS. I'm sure people have heard of, which is a kind of umbrella campaign of mostly like health related organizations. Doctors and Unite's in it, COVID Action is in it. And in relation to the strikes coming up in the NHS, I do think it would be really great if SOS NHS could, or maybe some organizations that operate within it, could produce a leaflet that links these strikes and the crisis in the NHS back to the issue of the pandemic, because I think that's kind of, maybe people think that that's kind of implicit, but I think generally it's being kind of erased that this isn't kind of one major driver of that absolute breakdown that we're seeing in the NHS, and also just the cumulative impacts that it's had over time, as well as current case rates. So I do think that in the same way that that the lawyers' strike kind of really drew attention to that issue of legal aid, that the NHS strikes can be drawing, can be as a part of the basis for solidarity with the wider movement, can be over the COVID issue. So I think maybe that could be an area for the campaign to maybe try to focus an intervention in supporting those strikes. I think, should we go back to the two speakers now? I appreciate that it's been discussion, not really questions, but pick up on whatever you think is interesting. And then we can kind of move towards rounding off, maybe with a bit of a view to kind of thinking about things to take forward. Should we switch the order? Jonathan, would you like to go first this time?
Thanks very much, Tazy. I'll try and be as quick as I can. The question about the Infection Prevention and Control Cell, or IPC as they like to call themselves, absolutely flat earthers. You would not believe how hard we've tried to find out who these people are, so that we can engage in some debate with them. They insist on remaining nameless. I did a Freedom of Information request about, not to get their names, but to get their expertise. And would you believe that out of a 40-person committee, there is not a single aerosol scientist for an airborne pandemic? Not a single one. They have been engaged in duplicitous and disingenuous conduct really from the get-go. And now what they're trying to do through mealy-mouthed wording in their guidelines is to pretend somehow that droplet transmission is the same as airborne aerosols. You only need to read the latest iteration to see how it's complete scientific nonsense, where they demand greater and greater evidence for airborne transmission, which is overwhelmingly being proved now and is the overwhelming opinion of the international scientific community. There is no evidence, I'm not exaggerating here for the purpose of making a point, there is no evidence for droplet transmission. They haven't come up with any studies. And yet the whole house of cards of their entire strategy for infection prevention and control in hospitals is built upon no evidence. The issue of vaccination and who's dying. Yes, the unvaccinated are much more at risk, but still vaccinated people are dying in hospital. And this is one of the problems of the vaccine not stopping transmission. So that's why we need all these other mitigations. Barbara, I don't think you're right that COVID as a disability has been ruled out. I've been retired for a few years now, but when you do a disability assessment of a patient as a GP, you assess the person's capacity and their ability to perform various tests, physical tests. It's not dependent on a diagnosis. And in fact, I think I remember reading somewhere that the Department of Work and Pensions has accepted COVID. But if you have information to the contrary, I'd be really interested to get that from you. Thanks. Hybrid meetings, Joan, absolutely essential. Doctors in Unite and the Hazards Campaign, Hilda Palmer was in the audience, I think she may have left. We produced a guide together on on how to hold a safer conference. You know, people should be masked, ventilation should be checked by the organizers, people should test before they go. The conference should be hybrid to enable those who don't want to come or who can't come for whatever reason to participate. I think it's really important. The issue about outside spread, I'm going to disagree with you a little bit. Yes, there is a risk. But theoretically, if you're in each other's faces outdoors and that person's positive, you may well get infected. But you know, if you remember the Black Lives Matter protest that happened in 2020, where nobody was vaccinated, there were huge protests outdoors. And in fact, the epidemiology afterwards didn't change very much. And it showed pretty much that outdoor gatherings are pretty safe. But of course, you know, if you're clinically vulnerable, I'm lucky I'm not, I would think twice. But I think if you're socially distant, if you keep 2 meters apart from somebody on a picket line and you are not in each other's faces and you're masked, I think you'd be pretty safe in that. Warm spaces provided by local authorities, great point. I think it's a really excellent way of raising the issue of ventilation and COVID safety with the local authorities. They're doing a good thing. They're providing, you know, warm areas in libraries and places like that where people can come. Have they paid attention to ventilation? And just quickly on the enough is enough and how receptive they are to other demands. We haven't actually tried locally. There's going to be one of their meetings here in Brent in November. And I certainly intend to raise it if I can. I was at a meeting on Saturday where there was a rep from Enough is Enough and one from the People's Assembly. And both of them were very open to working together and to looking at demands. We raised the issue of enlarging the demands. And the Enough is Enough rep was writing stuff down and saying he's going to feed it back to the I don't know who they are, but the executive committee, I don't exactly know who the structures are. I agree with the general point there that they could be more open and democratic and inclusive in terms of decision making. Thanks very much.
Thanks. And yeah, interesting to hear, because obviously Enough is Enough is such a big campaign that there's always going to be a lot of diversity in how people are responding to things. And also another thing that it has led to is like lots of more local meetings, some of which are kind of arranged as Enough is Enough meetings, and some of which are kind of just going with that energy and using the same slogans. And it does create a lot of spaces for debate where usually, you know, that it is possible to bring in different angles and stuff. Okay, are there any more hands? Maybe do we have any like any health workers or anyone who like knows about the strike ballots that are happening?
Graham has his hand up.
Oh yes. Oh okay. Graham, go ahead.
To ask a hopefully a fairly simple question. What views do the speakers have with regard to the Chinese policy, whereby they clamp down immediately if there's a COVID outbreak, regardless of how large or small it may be? What are their views about having an absolute rule whereby they close down immediately?
Can I answer that? Yeah, my view is that we get a very distorted view of this abroad here, because there's a big, you know, anti-Chinese drive from its geopolitical reasons, and I think it's very hard, therefore, for us to get any real voices of what people are sounding. But the thing is about what they've done in China, if they've saved like 4 million people's lives who would have otherwise died if they'd been behaved like the UK does. And I as far as I understand, they try and, at the moment anyway, they try and do very targeted lockdowns in, you know, small areas where they've identified an infection. But that's what I know. But as I said, I think it's extremely difficult to get a picture from here because of the biases against China at the moment. And I don't know where to turn to find out anything about what's really happening.
Thanks. For context, by the way, this campaign was until quite recently called the Zero COVID campaign. Obviously, China's strategy was at some point known as Zero COVID. I think they now call it dynamic clearing, and these terms are always somewhat flexible. New Zealand was another example of a country that also took that approach, but New Zealand, I think, found it generally easier to prevent cases from coming in than China did. So dynamic Zero COVID, that was reminded me. I think one point that I think is important, like kind of from a political point of view, is that that there isn't like one version of Zero COVID, and like there are kind of different ways and different like lines that you can draw about like things that like about ways to get to elimination or near elimination situations. Pat?
Well, I just wanted to say that China Daily website, which has not yet been banned in this country like some other websites have been, China Daily website does have some quite detailed reports about what measures are being taken in very specific cases in specific parts of China. And it's well worthwhile looking on there and looking at what's happening, because what Coral said is right, in that they have very tightly targeted campaigns to control it before it spreads further.
Thanks. Yeah. So we've got 10 minutes still, and we just went back to the speakers, so it feels odd to do that right again now. But does anyone else want to chip in about anything? I'm sorry that I keep on being like, does anyone want to talk about the strikes? But it's very exciting that there are strikes happening in the NHS, or ballots happening rather. And I do think that is like, if that goes well, I really do think that's going to be an opening to kind of put COVID back into focus.
The NHS position at the moment, I'm a national NHS campaign organiser, and things are going pretty well in the ballots. And at the moment, I don't want to sort of jeopardise anything that's going to be going on ahead, but at least 2 unions are opening and closing their ballots later than others. So it does sort of extend things rather. So at the moment, without going into actually any figures or anything like that, it's looking good at the moment. But as I say, they've got to get over 50% threshold anyway. So as I say, at this stage, it's looking good. But nothing's really going to happen until probably after sort of November time, I would say, at this stage. Because the results are not going to be fully in until around that time. So, and then they've got to be looked at and see whether they've met the appropriate threshold, because some unions have gone to an indicative like consultative ballot and others have gone to an actual strike ballot. So it does sort of mean that if say some unions have gone to just a consultative ballot, then they've got to go on to a strike ballot. So it's going to be a little bit drawn out, but it's looking good at the moment.
Good.
Great, thanks. I'm going to take Steve first, and then Jonathan, and then Coral, if you would also like to contribute quickly at the end. Do you think you would, or?
Sorry, I missed that.
Sorry, I was just asking Coral. Coral, would you also like to come back at the end, or?
I will see what everybody says. Yeah.
Sure.
Go
ahead.
Yeah.
Sorry, Steve. Did you go ahead, please? Steve, can you hear us?
Am I having to go?
Yeah.
Oh, I'm so sorry. I beg your pardon. I think the underlying question that we're trying to address in London as a centre, it's the corruption of politicians, really. The Cape asbestos thing really showed the amount of money that Cape was prepared to put into lobbying to get MPs to say asbestos is safe when everybody knows that it isn't. And it's only the same sort. It's very simple what's going on. And the people, we're missing the people in the room are the MPs and the councillors who go along doing stuff that they didn't ought to be doing. And that's not only in this country, it's the rich getting away with murder. But I think that's about all I need to say, really. And the unions, what's so fantastic about the unions, I know there's some people in the unions. Of course, there's people in the unions who are placeholders, who are sitting on their hands when they ought to be fighting. But nevertheless, the whole point about trade unions is that they are the most basic unit for workers to fight back. And so it's up to us. I beg your pardon, if you don't mind, just one more sentence. I was at the Labour Party conference and they were talking about, I forgot what they were talking about, but Mick, the RMT fellow was there. And he was telling them, he was addressing the other MPs on the platform. Look, we're doing what we can know how best to do, and that's to defend terms and conditions and wages. It's up to the rest of you to tell us how to join up all the rest of it. Don't expect that to come from the trade union movement. It's going to come from somewhere else. And this body here, you know, Independent Sage, is very well equipped to do that. So I'm positive in the way that I think Jonathan is as well. And certainly, I've forgotten so many of the people's names on this. The other Coral, you know, we can defeat this, but we have to learn to do it better. And well, we will do. We can do. We must do. Thanks for all that, and thanks for. I'm sorry I'm going on for long and not being well organised.
No, not at all. We can, we will, and we must. Love that. Coral, would you like to come in? One more? Sorry, I'm sorry I keep asking you, but because if not, I'll give Jonathan the final word now.
No, okay. I just wanted to say something about enough is enough. I know the demands are there's only 5 of them, but actually when you go into each of them, they involve other things. So the cost of living crisis involves nationalising gas, it involves nationalising energy, it does involve a whole lot, and also the Right to Food campaign involves looking at how food is produced, who owns it, and lots of things. So actually, they're sort of all demands, and it's very disappointing there isn't a specific climate one. But again, the same thing, the cost of living crisis is caused by the climate as well. So I think we need to be a bit generous to them and realise that underneath it all, there is an analysis of what's going on. So I say, yeah.
Yeah, that's a really good point, actually. Jonathan.
Thanks very much, Stacey. I just wanted to come back on the point about masks and the mask fit. Generally, they fit most people, is my experience. You're quite right in saying that a lot more could have been done and could still be done to advance the technology on masks. But you know, for those who maybe don't know, there's a type of mask which is called an elastomeric mask, which are reusable masks with changeable filters. They've got some good models in the US and in Canada in particular. The ones available here are quite big and look bulky and uncomfortable. And they've got silicone seals and they work extremely well. They'll give you a really, really good fit. Beards are not great for masks because they will break the seal. And therefore, it's probably better if you have a beard, shave around it, leave bits if you want to. And then you'll get a better mask fit. In terms of the alpha male and the macho, I'm not wearing a mask stuff, yes, the caving into that tendency has been quite deliberate in my view and encouraged, because it suits government and industry and business not to have to put into place any of these mitigations because it will save them money. And the stoking of what is after all a culture war on masks is to my mind a quite deliberate strategy to set us against each other, that, oh look, people don't agree on basic mitigations, therefore we shouldn't put them into place. Like everybody agreed on the tax cuts for the rich in the recent budget. So I think it's very important to point the finger of blame fairly and squarely where it belongs. And that is at government and government spin in terms of letting us all down, not having proper mask mandates. Like a country like Japan, it's not a big deal to wear a mask. Japan's death rate is 1/10 of ours, probably more. And yet everybody wears a mask, no problem. So I think there are reasons why these narratives, these very difficult and dangerous narratives are allowed to be so prominent, and they're given airtime by all the mass media, of course.
Yes,
It's a policy failure, an utter failure, and a deliberate attempt, in my view, to weaken mitigation measures. Thanks. I'll stop there.
Definitely.
Okay, thanks so much. So yeah, thank you very much to both of our speakers tonight. I think that was really, really informative and enlightening. So I'm just going to give a couple of quick shout outs for a couple of things. One is, if you're not already on the campaign's mailing list, you can sign up on the homepage of our website, which I've just posted in the chat. And if you just keep an eye on your emails, we always send out emails about events like this. And another thing that hopefully we'll have in the newsletter soon, and follow us on social media. And another thing that we'll hopefully have going out in the newsletter soon is we're hoping to set up like a collection of group chats on WhatsApp to link up people who want to kind of push COVID related issues within various trade unions. So I'm not sure exactly which unions we'll start with, but once we've got the ball rolling on that, we will send that out. And if you would like to help us set up one for your union, then you can email us at info@covidaction.uk. And other people from the steering committee, is there anything else we need to share right now? No? Okay, great. Okay. So yeah, thank you everyone for coming, and I can, if people want to do a digital round of applause or unmute, etc., to say goodbye and give some applause to our speakers. Okay. Have a good evening, everyone. Bye.